Hello everyone, in this video we are going to see about what is meant by medication error, its definition, types of medication error and how to prevent medication error. First of all, what is meant by medication error? Medication error is an event associated with the use of medicine that should be preventable through effective control system. Yes, medication error means it happens in a hospital setup or in a pharmacy setup, uh, where it is an event that is associated with the use of medicine that should be that can be preventable. These errors can be preventable, but it occurs in the hospital. It can be preventable. Hospital and pharmacy, how the medication error occurs means through there are different kinds of errors: prescribing error, dispensing error, like that. There are different kinds of errors which occurs in a pharmacy when dispensing. Mostly when dispensing, it occurs in a pharmacy due to workload. It will happens in a pharmacy. The pharmacist might take the different medication, take and dispense the different medication which was not mentioned in a prescription, look like medications, they will mismatch, or sound like medications. Some prescription will be not written in a proper manner, so that they get confused and give different kinds of medications. This happens during dispensing in a pharmacy. Then some kinds of errors occurs in during prescribing. Prescribing, the doctor will wrongly prescribe any kinds of medication, so that this prescription error will occur. Then sometimes in a administering error. Administering error means nurses will fails to administer, missing dose. Missing dose will be some kinds of error. Failing to administer the drug, or they will administer wrong kinds of drugs. These are the mostly errors happens in a hospital setting. Then the false prescribing is, for example, in antibiotics. They will give the medication based upon the culture test symptoms based. First of all, before taking the culture, they will prescribe the broad spectrum antibiotics only. Then after the culture report comes, they have to change based upon the sensitivity report. They have to change the medication, change it, adjust the medication. If the doctor failed to notice means, notice and continue the other medication, like broad spectrum medication, not narrow spectrum is given based upon the sensitivity test means, this is also considered as a error. Then wrong dose, omission error. Sometimes the patient and will miss the drug to take. They will voluntarily miss the drug, or some kinds like that. Errors will be happen in the hospital and pharmacy setting. These errors can be prevented by giving some effort. By putting some effort, we can prevent this kinds of error, like double checking. In hospital we can double check the medications before administering. In pharmacy, double check the medications before dispensing. Like that, if you put some time to prevent the error means, it can be preventable. So medication error means it's an event associated with the use of the medicine that should be preventable through effective control system. The American Society of Health System Pharmacists definition of medication error includes prescribing. error, dispensing error, medication administration, and patient complaints errors. These are some kinds of medication errors. Types of medication error: prescribing, omission, wrong time errors, unauthorized drug error, improper dose, wrong dosage form, wrong drug preparation, wrong administration, deteriorated drug errors, monitoring error, complaints error. First, prescribing error. Here, the main role will be played by the prescriber who fails to give the proper medication for the treatment of the disease, who may falsely prescribe other any drugs which the patient has no effect. Mostly in the antibiotic, they will do some mistakes, in some situations they will prescribe other drugs which the patient may allergic, like that. Or some drugs will have drug interactions, like that. They unknowingly are not checkingly, the prescriber will prescribe these kinds of drugs. Some drugs are contraindicated to this patient. Kidney diseases, some drugs will be contraindicated, or pregnancy, like that situations also they will wrongly prescribe the drugs. For kidney failure or liver disease patient, the dosage adjustment is not done. These are some kinds of prescribing errors. Omission error. What is meant by omission error means, omission means patient or patient attender or nurses will fail to administer the drug which was prescribed and has to be administered in the morning. They fail to administer the drug. This is an omission error. Wrong time errors. The this drug, one drug, if for example one drug, pantoprazole, like pantoprazole, it has to be administered in the morning and night only. The nurse unknowingly, or patient unknowingly, they will take this medication in the afternoon, not in the morning. They forget and they take this dose in the afternoon. It's a wrong time error. Unauthorized drug errors, then improper dose. Dose means is unknowingly taking wrong doses, or prescribing wrong doses, or taking wrong doses. These are come under the improper dose. Next one is wrong dosage form. Wrong dosage form means tablet. For instead of taking tablet, they might take injection. This kinds of errors are wrong dosage form errors. Then wrong drug preparation errors, wrong administration for some in nursing department, they which drug has to be administered in the subcutaneous, they might unknowingly administer this drug in a IV route or IM. These are wrong administration techniques error. Next one, monitoring error. They fail to monitor the patient symptoms, whether the patient having any symptom change or a reduction in the symptoms. They will fail to note these kinds. This is come under the fail to monitoring error. Next one is prescribing error. Types of medication error. There is comes a prescribing error. Incorrect drug selection. Yes, the patient is having tuberculosis. Tuberculosis means we will take the doctor must prescribe the tuberculosis anti-tuberculosic drugs, like isoniazid, rifampicin, like this drugs. But he will unknowingly take, he will suggest other antibiotics for not anti tuberculosis. They will the doctor will prescribe the other antibiotics. For some the common errors happens in incorrect drug selection is the patient have a fungal disease, but the doctor will prescribe the antibiotics. These are the common errors will occur. Or patient have a viral infection, unknowingly prescribing antibiotics. These are incorrect drug selection. Next, dose selection. Dose selection means the patient is having low patient is having symptoms, cardiovascular symptoms, but a block being, for example, block, the patient having a block in a artery near the heart, in a heart vessel. The block is lightly, the block is having in a small area, and the block clot is also in small. That means the patient the doctor must prescribe small, low dose medications only. But unknowingly, he will prescribe high dose medications. These are the some kinds of error. Then dosage form. Dosage form for subcutaneous insulin subcutaneous route, they will prescribe IV or IM. For IM route, they mistakenly prescribe IV route. Like this kinds of error. This kinds of error will the prescriber will prescribe, but the nurses will not recheck it. They will do whatever written in the prescription, right? So that this error will mostly this error happen due to the prescriber. Next, quantity. How many quantity you should take in a day? 3. Paracetamol 4 times a day. Like that, some tablets we should take 3 times, 2 times, or 1 time only. If we take one dose tablet, one dose tablet for 2 or 3 times means it will lead to overdose. So wrong quantity also, it's a very big error. Route, like for IM, IV, or tablet form. For tablet, they will return it as syrup. These kinds of errors are route. Next, rate of administration. Rate of administration, they will the prescriber will mistakenly write the wrong rate of administration. Then instructions by the prescriber. Whatever the instruction given by the prescriber to the nurse, he or she will follow that only. If any mistake happens in an instruction means this also considered as a prescribing error. Next one is omission error. Failure to administer the prescribed drug or dose to a patient. Yes. The prescriber will write whatever the medication to be needed for the patient per day. Whatever medication, whatever dose has to be administered, because it will only cure the disease, and it must be administered. Omitting one dose, it can lead to long problems in the reduction of the disease. So that if any dose failure to administer means it is also considered as an error. Next one, a wrong time error. Deviation from the prescribing timing of an ordered drug. Yes. Whether if, any time deviation. If the doctor prescribed to take this medicine in the morning, but he or she failed to take the medicine in the morning, and the next it has to be taken only in the night. It should not be given in the evening. He failed and he forgotten about that medicine, and in the evening time only he remembered. Then he will take the medicine. This can lead to double dosing. Right, so wrong time error is also a major problem. If the cholesterol tablets are most cholesterol tablets, we should take it in night time only. If we forget it in the night time, you can skip the tablets. Then take it in the next day night only. But they don't know about this, and they will take the tablet in the morning itself. These are considered as a wrong time errors. Next one, deteriorated drug error. Deteriorated drug error means administration of the drug that has expired or whose physical or chemical dosage form integrity has been compromised. Yes, taking the tablet which was expired. Expired means it will not give any effect, right? We will take medications only to produce an effect. And we will take these medications only to cure the disease, right? If there is no effect produced by this drug, means it is leads to failure of the treatment. So that taking the expired drug is also considered as a major error. Next one, monitoring error. Failure to review a prescribed regimen for appropriateness or failure to assess response to the prescribed drug. Yes. Failure to monitor the effect of the drug. In a patient who was in ICU or an admitted patient, the doctors will prescriber will check the daily improvement of the patient. If the patient is whether the patient is improving for the treatment, or he was decreasing with this treatment or not, so that we can adjust the dose or drug based on the response of the patient. So failure to monitor the patient, whether if we not monitor the patient in one day, is also considered as an error. Next one, compliance error. Failure of the patient to adhere to the prescribed medication regimen. Adherence means taking the medication properly which was prescribed by the prescriber without stopping the medications. This is the medication adherence. So if we fail to if the patient is failed to adhere to the medication, means this will lead to this will not cure the disease. The patient adherence is directly proportional to the reduction of the disease. So we should encourage the patient to take the medication without missing any doses. This if any doses is missed, means it also leads to an error. Next, other kinds of error we have seen: prescribing omission, wrong time also we have seen. Next, deteriorated, improper dose error. Improper dose error means yes, giving wrong doses. Like for example, pantoprazole 20 or 40 mg we mistakenly given prescribed as 25 45 mg, like that, means it's also considered as an error. For if a 20 mg tablet only needed for the treatment, but prescriber is mentioned it as a 40 mg, it is also considered as an error is a wrong dose. Wrong dosage form. Dosage form means tablet, subcutaneous. These are considered as wrong dosage form errors. Next one, wrong administration errors. Administration is also an error, some kinds of error. Next, how to prevent a medication error. First of all, should review the floor stock to exclude. Yes, always check the floor stock. Monthly once or monthly twice you should check the floor stock and to exclude all the expired drugs, so that the taking expired or taking or dispensing expired drugs will be prevented. Next, use of proper labeling of the drugs. Yes, we should label, the label must be clear, so that we will dispense the correct medication, taking the correct medication based on the by seeing the label. So the labeling must be clear. Look alike, sound alike medication sold separately. Some drugs will be, both the drug will be like same look-alike medications. So some look-alike medications must be stored separately. Some drugs mg must will be changed, but they will like same drugs only. So this we will mistakenly will dispense the wrong mg drug. So it should be kept separately, and we should remember always these kinds of mistakes, so that these kinds of mistakes will be prevented. And perform double check as prescribing. While prescribing also we should double check the prescription, whether we the prescriber prescriber prescribed the correct drug. Dispensing time also we should double check dispensed drug. While taking from the box also we should check it before packing. Also we should check the medications. Administering the drug, yes, nurses while administering the drug always double check. If you have any doubt means you should ask the doctor or prescriber by checking after getting clear definition only you should administer the drug. Develop strategies to overcome illegal prescribing. Yes, illegal prescribed drugs should not be given. Use capital letters while prescribing drug. In the prescription use the capital letters, so that only it will be clearly understood by the pharmacist, and they will dispense the correct drugs. Abbreviations, do not use any abbreviations in the prescription. Abbreviations, most drugs will have same abbreviations, and they will mistakenly dispense the wrong drug. So avoid abbreviations. Specify exact doses of the drug. Yes, correct doses must be mentioned. Don't mention it in like ranges. For a pantoprazole 20 mg means 20 mg must be mentioned there. Do not mention 20 to 40 mg like that. Standardize the prescribing and or order entry. The prescription must be in a standardized manner, so that the errors will be prevented. The prescription must in the prescription should mention the age, sex, weight of the patient to calculate the dose, then the drug, their dosage, and then route of administration, frequency, duration should be mentioned clearly, dosage form also mentioned clearly, so that it will the mistakenly dispensing problem will be avoided. Computerized prescription order entry. Yes, nowadays computerized prescription has been launched. It will help to prevent most kinds of error. By using the computerized entry, most kinds of errors are prevented. Next, the prescription error. In the medication error, the pharmacist will play the major role for controlling the prescription error, like prescription and other kinds of error. In a pharmacy, the pharmacist must, the error will happen in the pharmacy mostly in the dispensing expired drugs, dispensing wrong dose, wrong drugs, like that. Uh, this kinds of error will happen in a pharmacy. To avoid this kinds of error, the pharmacist always check the expiration date of the drug. You should check the expiration date twice in a month. Then you should, before dispensing also, you should double check the medication you dispensing. First, when you take it from the box also, you should check. Then before packing and dispensing also, you should check. Then also you can advise the patient about proper taking of the medication without changing, or without changing any time changes, or without missing any dose. You should properly take the medication. You should explain about the usage of taking the proper medication in the proper time, so that only they will come to know about the importance of taking medication without skipping them. So the skipping errors, omission errors, these kinds of errors will be avoided. And you should also inform, do not double dose the drugs, and wrong time. Do not take the drugs in a wrong time. Mostly pantoprazole, some kinds of insulins must be taken before food. Um, to avoid after food insulin, after food glucose increase, and to prevent acid reflux, this kinds of drugs we should take it before food. So you should inform the patient. You can set, if you will forget, means you can set the alarm, so that you will remember the correct time of taking this drugs. But that wrong time administration errors are also prevented. Next, in hospital, after the prescriber prescribed medication, you can double check it. If you have any doubts regarding the prescription, means you can ask the prescriber or other pharmacist about this, so that this kinds of prescribing error, dosage adjustment errors by the prescriber. Prescriber will be must very in a busy schedule, right? So that they will not they will unforget, they will forgettingly mistake and enter the wrong dose, or they fail to adjust the dose. If they will forget to uh, dosage adjust, they forget the dosage adjustment in the kidney or liver failure patients. This kinds of time, the pharmacist can double check the prescription, and they will know, right, about this, and they can adjust the dose, and inform to the prescriber about this. After discussion, they can adjust the dose and prevent these kinds of error. Next, in an antibiotic, is mostly in an antibiotic stewardship, they can pharmacists can do antibiotic stewardship antibiotic stewardship system, so that in that they can mention the high end antibiotics. High end antibiotics, if the patient is going in an ICU or in ward, the patient is going on in a high end antibiotic mean, they can take the list of that patients, and for what the high end antibiotic is given based on the sensitivity test or culture report, or simply based on the patient condition, for what the high end antibiotic is given, and in which dose is the high end antibiotic, how many frequency and how frequency is going on in a high end antibiotic. They can easily check that, and if any dosage change or frequency change happens or drug change happens means, they must have a strong reason. They can ask the prescriber for what they have changed the dose or for what they have changed the drug. And for this kinds of information, we can ask and maintain a high end antibiotic chart, so that these kinds of antibiotic error are prevented. This in this all medications error, the pharmacist play a main role in the prevention of this kinds of error. Next, also in some kinds of errors, like uh, some kinds of error will happen in a pharmacy or in a nursing field. The administration error will happen, right? So this kinds of administration, how can we prevent means, mostly nurses will have a high workload. They will do whatever it is mentioned in the prescription. So before the nurses administering medicine, the pharmacist, the clinical pharmacist should check this everything, and he should put a sign. The sign, after signing only, the nurses have to administer the drug. This kind of kinds should be followed in a hospital, so that this nursing errors, all kinds of errors will be, and nursing administration errors will be prevented, because wrong administration will lead to severe complications. Wrong route administration or wrong medicine administration, like several kinds of administration which can lead to severe complications, so that these kinds of errors can be prevented by the pharmacist by double checking and putting a sign. Next, we should also um, before admitting a patient, we should check the patient, whether the patient have any allergies also. Some patients will have penicillin allergies, so that before that we should ask the patient whether they have admitted before any in other hospital, whether they have any allergies for the any medications, and also that this allergic false medications, by re-administering the allergic medication error will be prevented by asking the patients before administering any kinds of medications. So this is this all comes under a medication error. In this video, what we have seen is what is meant by medication error. Next, types of medication error. What are the types of medication error? Next one is how to prevent the medication error.